everyone, I'm Lauren Beatty. I'm the Director of Communications for Kansas Action for Children, and today I'm going to talk to you a little bit about our Pass on Pop campaign and how you can become involved in it. Before we get started, I would like to tell you a little bit about Kansas Action for Children. We are a nonprofit, statewide child advocacy organization founded in 1979. For about 30 years now, our mission has been to shape policy that puts children first. We do this by advancing public policy that provides children with the resources they need to meet their full potential. We focus on 3 areas: health, education, and economic security. We believe that children who are healthy when they start school have a greater capacity to learn. We also believe that access to early childhood programs give children a greater chance for success in school and in life. And we also work to ensure supports for families are a priority in the state budget. So today we're going to talk about the Pass on Pop campaign. And as you can see from our agenda here, I'm going to give you a little background on the campaign. We'll also give you some information about the role of sugar-sweetened drinks, and also a couple tools that will provide you with the information that you need to get your congregation involved in Soda-Free Sundays. The Pass on Pop campaign began in January 2014. We hope to raise awareness about the role of beverages and the impact of added sugar on everyone's health. We're asking individuals, organizations, families to go soda-free every Sunday in 2014. This effort is led by us, Kansas Action for Children, with support from the Kansas Health Foundation. We have gotten a lot of questions about why this type of campaign is important. And for us, it's really a lot to do with the childhood obesity rate in Kansas. There are about 700,000 children in Kansas, and 1 in 3 between the ages of 10 and 17 are overweight or obese, and this trend is climbing. Children are touched by food and beverage environments at home, at school, and in childcare settings. And the long-term risks associated with childhood obesity include diabetes and heart disease. So raising awareness about the role of food and beverages is something that was really important to us at Kansas Action for Children. So what exactly is the role of beverages on your health? Well, soda and other sugar-sweetened beverages contribute calories but no nutritional value. Sugary drinks also contribute to poor health outcomes like dental problems, being overweight, being obese, and diabetes. Diet soda too has its downsides. People who drink diet soda tend to consume more calories. It's also bad for your teeth. So far, more than 300 individuals and organizations have taken the pledge. We have 25 organizational adopters, including the United Methodist Health Ministry Fund and the American Academy of Pediatrics, the Kansas chapter. Our celebrity spokeswoman is Miss Kansas 2013, Teresa Vale. I'm sure many of you saw Miss Vale competing in the Miss America competition. She received quite a bit of attention across our state and across the country. She was a top 5 finisher, and she's also a proud member of the Kansas Army National Guard. Ms. Vale is a native of Manhattan, and she hopes one day to become an Army dentist. She has a strong focus on health, and she's also a prominent representative of Kansas, which is why we asked her to take the Soda-Free Sunday pledge and help us promote this to other Kansans. So now we're going to talk a little bit about how you can become involved in the Pass on Pop campaign. One of the easiest things to do is simply just talk about it. Communicate with your members and explain why your faith community is signing on and how cutting back on sugar-sweetened drinks fits with your mission and your values. Your church has the power to inform and influence members of your congregation and your community about the pressing issues of obesity in Kansas. Here are a couple scripture passages that are relevant to this campaign that you could share, although there are many others as well. Even when you know what food or beverage options may be the healthiest, it's challenging to make good choices all the time. We know that. When healthy food and beverages are more accessible, individuals can make better choices for their health. Food and beverage environments that ensure healthy options are the routine, easy choice will have a significant impact on the health of all Kansans. Helping to create food and beverage environments that ensure healthy options are the routine, easy choice, improve children's health, and improve the children's ability to learn. Also important to keep in mind is to shape policies that can support better food and beverage environments in your church, in your children's schools, and in your larger communities. By making changes to policy, you can ensure that improvements continue in the future and reach more children. Now, how can you share your commitment with your larger audiences? An easy way is to like the Pass on Pop Facebook page. I know many of you are on Facebook. We post something nearly every day, either a news article or pictures or tips that you can share. You can also share your own story on our Facebook page. We want to hear why your faith community is choosing to take part in Pass on Pop. We also are tweeting about Pass on Pop using the hashtag #PassOnPop. So if you're on Twitter, be sure to use that hashtag and share the message. So what else can you do to promote the Pass on Pop movement? Think of some events or holidays to connect with the campaign. For example, this is a graphic that we use to highlight Pass on Pop on Super Bowl Sunday using a little bit of humor, and you can do the same. And now I'd like to discuss a little bit about other ideas that you may have. So I'd like you to discuss in your groups if you have any ideas for events or messaging, and think about if you expect pushback from members of your congregation and how you can respond. Now we'll go through some commonly asked questions and possible areas of pushback. The number one question that we get is, why Sunday? Well, this campaign is about talking about the role of beverages in health and making changes as a family or faith community, and Sunday is a great day to work on this problem together. Plus, it's easier to start small and choose healthier beverages just once a week. Then maybe after you realize how easy it is and how good you feel, you'll choose to go soda-free on other days as well, and that's great. And soda-free Sundays is a lot catchier than soda-free Thursdays. Another question that we get asked a lot is about diet soda. Obviously, diet soda doesn't have sugar, so it can't be that bad for you, right? Well, too bad. It's actually not that great for you. The artificial sweeteners found in diet soda can make you crave sweet foods and ultimately consume more calories. Another question that we get asked a lot is why we're focusing just on drinks and not encouraging the reduction of eating cake. Although this campaign highlights the role of beverages, healthy eating and getting physical activity are also important parts of being healthy and healthy living. All food and drinks with added sugars should be consumed in moderation. And unlike sweet foods, which are high in calories but it will eventually make you feel full, sugar-sweetened drinks provide calories but don't satisfy hunger. And that's why we're really focusing on this easy campaign to raise awareness about beverages specifically. So here's a kind of a tough question. We know that you are committed to the health of your congregation, but you might be a little bit afraid that something like this will upset some people, and we understand that, and we realize that that's a valid concern. But we really would encourage you to discuss why this is important to you and how it fits with your organization's values. Also, make sure that alternative beverages are available and appealing. If you have tea, seltzer, or infused water available for your congregation, it just makes it that much easier. Well, I want to thank all of you for your time. I appreciate your interest in Pass on Pop. I would encourage all of you to go online and take the pledge on behalf of your congregation. Our website is up there. It's kac.org/passonpop. Share the pledge with your congregation. Invite individuals and families and coworkers to take the pledge with you. You can also like our Pass on Pop Facebook page. The URL is facebook.com/passonpop. And let us know how your congregation is doing with Pass on Pop. We'd love to see stories and pictures and even recipes from you. We also are using Twitter. The hashtag is PassOnPop. And if you need any additional support or materials, you can email my colleague Hillary. She is our Director of Health Policy, and she is heading up this campaign. Her email address is hillary@kac.org, and I know that she would be happy to help you and provide any materials or support that you need.